this is not an old case. In fact, it is a current case, and so we wanted to bring information to the public as quickly as we possibly could this morning. The details are as follows. An 81-year-old gentleman travelled with his daughter to Argentina. He was vaccinated while he was in Argentina with a single dose of the vaccine. He returned to do his full 14 days of quarantine in New South Wales. While he was in New South Wales, he sustained a fall and was admitted to hospital, and he was in hospital there for 10 days. He returned to South Australia on the 8th of July. Symptoms developed over the weekend. On yesterday, he went into the Modbury Hospital. He was tested, and as I said, pathology received that result at 2:30 this morning. Not waiting for further tests, we immediately put family members into quarantine, and I can report to you today that his daughter and 6 close contacts were immediately put into quarantine and were tested. We already have 2 results back. His daughter and his grandson, they are both negative, but the further results will be coming in over the coming hour or so, and so we will need to, of course, have a further update later today. Can I say that we have immediately put our contact tracers, our senior contact tracers, onto this situation. We want to move as quickly as we possibly can. We will have some exposure sites to announce for you today at this press conference this morning, and probably further exposure sites this afternoon. Again, I want to thank the people of South Australia for using the QR check-ins. This is really helping the Communicable Diseases Control Branch, who are doing the contact tracing. It's enormously useful information, and another reason why every South Australian should be using their QR code check-in every time they go out into public. I would just like to also update people on the New South Wales Removalist situation. I think we're now at day 10 or day 11. As people know, we've had hundreds of people in quarantine with regards to that situation. And the good news is that to date, we haven't had any further positive cases. So we're still keeping people very closely monitored, still going through with all of the testing regime. We know that there is a 14-day incubation period, sometimes slightly longer for this disease, and so we want to continue to monitor this situation very, very carefully. But in this situation, we are feeling more comfortable about that situation here in South Australia. Of course, there is a continuing deteriorating situation in other parts of the country. We are very concerned with what's happening in Victoria, especially with the spread of the new infections going right through to Mildura. The State Coordinator, Commissioner Grant Stevens, made some adjustments to our border restrictions late yesterday. There will be a further directions meeting this afternoon here in South Australia following getting all of those test results back. And then it is very likely that there will be further internal restrictions put in place in South Australia later today. But at this stage, we do not envisage a lockdown situation immediately in South Australia. As I said, the results that have come back so far with the daughter and also the grandson are both negative, and so that's very good initial information. And a very good initial result, but of course everybody who has come into contact with this 81-year-old gentleman will now need to go into 14 days of strict quarantine, directed quarantine, so that we can contain this as quickly as possible. What I can also announce to you today is that the Elizabeth Vale Primary School was proactively put into a closed down situation until we could be absolutely 100% sure that the grandson was not at the school during the break. That has now been confirmed, and the Elizabeth Vale Primary School will reopen tomorrow. With regards to the Modbury Hospital, you would note that there have already been some changes to public access to that hospital. We are doing that full risk assessment at the moment, and we hope to be able to progressively reopen that hospital as soon as it is safe to do so. I'll answer any direct questions now, then I'll pass over to Professor Nicholas Spurrier and then ultimately on to Commissioner Grant Stevens.
Premier, do you know where the 81-year-old is at the moment? Is he in the RAM?
My understanding is that he is in the Royal Adelaide Hospital.
But did the man see out the 2 weeks of quarantine in Sydney?
That's my understanding, but there was a subsequent fall and then he had a further 10 days in hospital in New South Wales. So we don't draw any conclusions as to where this infection came from. We simply don't know. This is very, very early days. As you can imagine, the team has been working through the early hours this morning, but we think it was very important to come out this morning, let people know what we know at this point in time, but there will be a subsequent update later today.
Do we know how much he was out and about over the past almost 2 weeks?
So there have been a number of exposure sites, and in a few moments' time, Professor Nicholas Spurrier will go through some of the exposure sites that we already have documented, but there'll be further announcements right throughout the day.
Premier, can I just ask you two questions? Firstly, what he had AstraZeneca, I'm assuming?
No, he had his vaccination in Argentina, and I'm not sure what vaccine that was there.
Okay, and do you have a time frame of when this gentleman returned to South Australia?
8th of July.
8th of July, which is before the new rules that came in.
Correct.
About the next 2 weeks of quarantine.
And this is one of the reasons which underscores, we have taken a prudential situation in South Australia with regards to the additional quarantine that needs to occur subsequent to people leaving quarantine interstate because of our heightened concerns with regards to this Delta variant. So it underscores why we take these positions, but of course he's come back prior to that new direction being put in place.
Do we know why he was allowed to leave Australia in the first place? Was it for a holiday or compassion?
No, it's still very, as I said, still very early days, and our primary concern at the moment is putting everybody that could have possibly come into contact with this gentleman during his infectious period into quarantine as quickly as possible, getting those tests done, getting those results back so that we have more information upon which to make decisions upon the next stages in South Australia.
And patients and staff are being transferred to a Medi hotel, is that right? Do we know how many?
I'll get, as soon as if any more questions for me, and then I'll pass over to Professor Nicholas Spurrier, who'll be able to give you far more detail with regards to the health response.
Premier, about the situation with Mildura and Renmark. How concerned are you about any sort of potential leakage into the Riverland region, and what's your advice to people?
Look, we're really concerned at the moment. I think the whole country is on high alert. It has been for some time. I think people woke up on Saturday morning, 12 million Australians woke up on Saturday morning, and they've all had to go into a lockdown situation because we're really concerned about the situation that exists. With some other clusters previously, they've been very, very localised, and health authorities interstate have been able to really shut down suburbs, restrict movement and contain the clusters. Unfortunately, the situation in Victoria at the moment is that there are widespread new cases popping up. So they've taken the right action to really reduce mobility in Victoria. We're very concerned, of course, though, because it is very close to our border up in the Riverland. So strong message to all South Australians today is if you develop any symptoms whatsoever, please go and get yourself tested. The testing rates over the weekend were amongst the highest we've ever had. So a massive thank you to the people of our state. But now is not a time to be complacent. We're on high alert in South Australia at the moment. Any symptoms whatsoever, please go and get yourself tested. Let's not take any chances. And when we're out in public, make sure that we're using that QR code check-in. As I said, we're very pleased with the progress of the case of the New South Wales Removalist coming into South Australia. We were very concerned about that. As every day goes by, we're less concerned about that case. But with this case now, this 81-year-old gentleman, he has been out. He's been out and about in the community. We've now got to identify those people who could have potentially come into contact with him, get them into quarantine as quickly as possible.
Premier, when you talk of potentially, as you said, very likely more restrictions coming, often triggers a slightly panicked response in the community, particularly when it comes to shopping. What's your advice to them?
Look, there are going to be additional restrictions being put in place later today, but it's very unlikely that we're going to be announcing a lockdown in South Australia. And my strong message to the people of South Australia is that we need to just respect these restrictions that are being put in place. No need to panic whatsoever in South Australia. There is no need for a run to the shop urgently in South Australia. We need to gather more information. We'll do that today. We'll keep the people of South Australia informed.
I'm guessing we don't know what strain it is.
Look, we're just assuming that it's the Delta variant because that's the dominant variant in Australia at the moment, but we don't have the final genomics of this case back yet. That usually takes about a 24-hour period, but we're just assuming at this stage that it's the Delta variant, and that's why we're concerned.
Can I just ask you, and it may be the Commissioner or Professor Sperry might know this, do you know if the family or the gentleman in question used QR codes over the past however long he's been in South Australia?
No, I don't have that information just yet. So, but I know that we do have we have downloaded QR code check-ins. Now, I'm not sure whether they've come from the gentleman or his family or other people that have been put into that situation. But look, it is one of our best lines of defence, the QR code check-in, because as of the early hours of today, we could look at data, we could get in contact with people first thing this morning, and we could put them into a situation which will protect our state.
Can I also, clarify, the Modbury Hospital, parts of it is closed, the emergency department is closed. Are there any other parts of the hospital that are now off limits to the public?
So at the moment what we're doing is taking a very prudential stance with regards to the Modbury Hospital, but the risk assessment is being done at the moment. In a few moments Professor Sperry will update us, and we are hopeful that we can progressively reopen that hospital to the public, but we don't want to take any chances with regards to this. We've seen the devastating consequences in other parts of the country, other parts of the world with regards to this Delta variant, and so we're going to take this very, very carefully in South Australia. We don't want a lockdown if we can avoid it, and that's why at the moment the next 24, 48 hours are going to be absolutely critical for our state. I'll pass over now to Professor Nicholas Berry for some more information.
Thank you, and good morning. So it is a very serious situation we have now in South Australia with this positive COVID case. And just to perhaps give some clarification, obviously this is very new information. I was phoned at 2:30, and during that time we've had our senior contact tracer take an interview with this gentleman's daughter. So we're getting more information as we speak, and we will be updating this on our website. But my understanding is that during the time that this gentleman was in quarantine in New South Wales, because of his health conditions, he needed to go into a hospital rather than stay in a health hotel, or what we would call a medi hotel, for the entirety of his quarantine. So my understanding is that he did his 14 days of quarantine with a mixture of being in a medi hotel and also in the hospital there, and that he didn't test positive during that time. Came back to South Australia, and as the Premier said, developed some symptoms and then was taken to Modbury Hospital on Sunday. So taking a history, and I'll just follow through some of the information that we've gleaned from that, and also to thank the family who have been incredibly helpful with us trying to get this information as quickly as possible. So this is an elderly person that does have other health problems, and so it's quite difficult sometimes to appreciate when you might be getting symptoms and when you might start to feel unwell. So we're saying that it's likely the 17th, so that was Saturday, and if we go back 2 days, and in South Australia we tend to use 3 days of an incubation before symptoms develop. So we feel that his most infectious period is from the 14th up until now. Of course, he did come into the state a little bit before that, so we're going to be doing contact tracing right back until the 8th, but we're focusing on this higher risk period, particularly the last couple of days. Now, because this gentleman is an older person, whilst he has got some community exposure sites, he hasn't been to any large COVID management plan activities or any of these higher risk activities, but I can give you a bit more information on in terms of some of the exposure sites. Just a little bit about the testing as well. So we did have a test that came through at 2:30. We always need to verify that, but also because he's come from overseas, occasionally we do have people that still are able to shed the virus even though he tested negative in New South Wales. Although that initial test did suggest that he was quite infectious, we've got some parameters on the test to be able to make that call. So SA Pathology were able to run some serology this morning, and basically what the clinical virologist put in the email to me was this was an acute infection with a high viral load, and so that's what we will be treating this as. People might say, well, he's been, received a vaccine. How do you make that call? So we use our specialist virologists to make that sort of judgment. With respect to Modbury, first of all, I'll just go a little bit more into the close contacts. So he has in fact got 16 primary close contacts that we've been able to get information about today. So he's got quite a large family here in South Australia, and we've been able to get the phone numbers of those people, and those people have been contacted to stay put. We're organising domiciliary specimen collections, so COVID testing this morning, and SA Pathology will put that on their rapid turnaround testing, so we should have those results coming in over the next couple of hours. As the Premier said, we have a result back from a grandson, and we wanted to get that because this person was involved with this primary school at Elizabeth Vale, and that one is negative, which is fantastic. His daughter's test is also negative. Now, just to qualify that, because his daughter's also been to Argentina, we haven't had a chance to work out whether she's been vaccinated, whether she's had COVID before in Argentina. So it's good that it's negative, and certainly, therefore, she hasn't posed a risk, but we're not sure exactly how immune she was to being able to get infected from her father. So in terms of Modbury, obviously when we make decisions about closing parts of a hospital, it has big impacts on our healthcare system. And at the moment we have 27 patients and 25 staff that were in the vicinity when this gentleman came in to the emergency department. Now, the information I've got so far is that he didn't actually enter the standard emergency department. He was recognised that he had a respiratory infection, and he was taken straight to what is called the emergency extended care unit and was put into a negative pressure room. So the staff at Modbury did a fantastic job dealing with that, but just to be very precautious, we've taken a bit of a blanket approach to closing that emergency department for the time being, while somebody in the communicable disease department will be doing a risk assessment, and we will be hopeful that we can start to open up those services, but we need to do that formal risk assessment to make sure that everything is safe as much as possible. But perhaps more importantly from a public health perspective, because of course these exposures of staff have just occurred recently, and we're following that up, and they would not have had enough time to incubate the virus and become infectious themselves. So I've got a couple of locations. So again, this is very, very quick contact tracing work, I have to say, from my team's perspective, just to let people be aware of, and this will be going up on our website as well. So and also to say that the team are contacting these businesses as we speak. So on the Saturday, the 17th of July, the gentleman visited the Golden Grove OPSM, which is an optician, and that was from 3 p.m. to 3:45 p.m. And we will be using QR codes as well to be able to SMS quickly anybody that was there at that time, but it will go up as an exposure sign. The other one is Hindmarsh Gaganis Brothers, which I understand is a large food warehouse, and that was Friday the 16th of July from 1 until 2:30. And then the other site that I'm going to be able to tell you about this morning is Modbury Commonwealth Bank, and that was both on Tuesday the 13th of July and Wednesday the 14th of July. And the 13th of July was 10 until 11:15 a.m. and the 14th of July was 10:30 to 12:15 p.m. So what the team will be doing is contacting those businesses, obviously letting them know, getting in contact with staff so that those staff can be tested, and then because of the QR check-in system, we'll be able to SMS anybody that was at those particular places at those points in time. And there may be additional sites, but we're bringing that information together, and I at least had this that I could share with you this morning. The other thing that we can do is, because we now have 16 primary close contacts, we can also, now that we have their phones, we've already looked at where those people have been, and that is looking for secondary close contacts of those primary close contacts. So that's another piece of work, and there will be other people in South Australia that will receive an SMS to say that you are a secondary close contact and you need to quarantine. And this is our double ring fencing, which is the method that we use in South Australia to try and get ahead of this very infectious and transmissible disease, particularly the Delta variant. So those are the details that I have for you this morning. I'm very happy to take questions, but obviously we're in a serious situation. We're right in the middle of getting this information and providing it to you. As the Premier said, the Commissioner, I and the Premier will be updating you later on this afternoon as more information comes to hand.
Professor, the mere fact that the close contacts, being the grandson and the daughter, have tested negative, you would think they'd be rolled gold candidates to get it first up. So is that a good sign that no one may have it?
Look, it's a very good sign. I'd like to see all the tests come back negative, but just to put it into context, which is why I explained a little bit more about the daughter's situation, it may be that she is immune to COVID-19. I don't have the details of how much time the grandson spent with the grandfather. We do have other family members and also friends of the family that we need to get those results back for. But also just to say that whilst we'll have those 16 close contacts, and that's really quick work from our communicable disease branch, and I'm really grateful for people coming in during the night to do that, we will have times when this gentleman has been in the community, and we know with the Delta strain that the transmission can occur with very fleeting contact with other people. So it is, Mike, a wonderful thing to have had those negative tests back this morning, but I'm going to feel more confident over the next couple of hours as those tests roll in.
Professor, do you have a time that the patient was taken to the RAH this morning? Now, I asked that for a reason, that we got pictures of someone arriving with the staff in full PPE and the patient not. Do you have a time on that?
No, I don't have a time on that. Now, of course, if the person has respiratory problems, it may not be possible for that person to be wearing a mask. What is important is that the staff are wearing full PPE.
Professor, what is the man's condition or clinical condition, and is he in the COVID clinic or has he been taken to intensive care?
My understanding is that he's in the COVID ward, and I don't have any clinical update on his condition, but it would be the most appropriate place for an elderly person with COVID.
Do you have any understanding about why this gentleman was able to travel to Argentina for whatever grounds?
No, and I don't have that information, and in fact this gentleman may well have been in Argentina for quite some time, and his daughter may have gone back to assist him coming into Australia, so I really don't have those details.
Can I ask about his quarantine? Can you just confirm, so he did 2 weeks of quarantine in Sydney, part of that was in a hospital because he fell over and had an injury. Was he tested, I'm assuming, before he came to South Australia from New South Wales, and then why did he not have to quarantine when he got here? Yeah, so there are very rigorous protocols requiring for quarantine in New South Wales, the same as here, and it would have had all of that testing done. So again, we just got this information last night. That's all I can bring you today. I'll be going into AHPPC, getting more information from our New South Wales counterparts and such like, but really for me, it's what have we got in front of us, and let's get ahead of this virus now here in South Australia. He got into South Australia before the rules changed and people coming from New South Wales needed to quarantine.
Yes, absolutely. So that was brought in, I think, on Friday, and it was in response to a child who had tested positive coming from New South Wales, quarantining in New South New South Wales and then going up to Brisbane. And last year, when there was really the first wave and the second wave in Victoria, we did require people to do that second lot of quarantine, even though it's in their home. And you can see now justification for that.
Professor, sorry to labour the point on this morning's RAH arrival. Would it be normal practice for someone who is a COVID suspect or a positive case to be given a police escort with the ambulance?
Look, I can't comment on that. I mean, we put in process the things that need to be done. Probably the Commissioner can speak on in terms of the police escort.
Can I ask what's happening with Modbury Hospital now? You mentioned 27 patients and staff. Are they all going to a Medi hotel? Is that correct?
The patients, I believe, are likely to be transferred to the Royal Adelaide Hospital, but I just got taken out of a meeting as those things were being discussed, and the staff will be going to a Medi hotel for their quarantine.
And is the Lyle McEwen involved at all?
No, not at all.
Professor, just to clarify, there's no suggestion that this 81-year-old gentleman has done anything untowards with regards to his quarantine once he's come back into South Australia?
Absolutely not. No, nothing at all.
Without going into his private clinical arrangements, Professor, can you potentially give some indication on what sort of symptoms the man was showing when he presented? Apart from, you said respiratory, can you provide any clarification on what those were when he arrived at Modbury?
I'm sorry, I don't have those details, but respiratory symptoms generally mean a runny nose, sore throat, a cough, and so I would presume it was something along those lines.
Professor, you've got a bunch of vaccines being rolled out in rural chemists today. Is there a hope that that will bump up those vaccination numbers, or are people a bit too reticent still?
Oh, look, I absolutely think they will bump those numbers up, and I think South Australians are desperate to get vaccinated. We can see what's happening in other states. We don't have much time. As soon as it's available for you and you're in that age group, you need to get vaccinated. And I think South Australians understand the urgency of doing this.
Professor, can I ask you about testing in the Riverland? Are you looking to further expand SA pathology services in the Riverland in light of what we've seen in Mildura to handle any sort of spike in demand?
Yes, look, SA pathology and also ClinPath and ACL, our private labs, are very responsive when we need increased testing. Just bearing in mind, we have a limited workforce because it's a small state. We've got our nurses working and pathology collectors working both in the pathology and in vaccination, and also in our Medi hotels and also in our hospitals. So we do a good job at juggling that, and this is the same situation. We will be doing the same.
Professor, can I just ask, is Salisbury Uniting Church in any way connected to this gentleman?
I haven't seen that one listed, Mike. Not to say that anything could pop up, but it certainly wasn't in the list I saw this morning.
And just to confirm, Professor, I answered for this question to the Premier, you have obviously reservations about potential leakage from Mildura into the Riverland at this point in time. What's your advice to the community up there?
So we're providing really quite strong advice, and if you recall those VMS boards that when we had the first wave you saw on our streets, and it had lots of information on it, my understanding is that will be happening up there in the Riverland. We want people in the Riverland to reduce their movement in and out of that area until we've got more clarity on the situation in Mildura. There's a lot of traffic between Mildura and Renmark, and this person who was infectious way back till the 11th, so that was a week ago, when there weren't any restrictions for regional Victoria and South Australia. So the other thing I also wanted to say to South Australians generally, if you can reduce any movement of yourself so don't travel into the Riverland if it's for non-essential reasons, that would also be much appreciated.
Do we know what hospital he was in New South Wales? There have been a couple of leaks in New South Wales hospitals, so I'm guessing that's something you're looking into, whether he caught it there.
Yes, I don't have the name of the hospital. I just want to make sure that we have clarity on that before we make that public.
Professor, this may well be something you don't have information on just yet, but is there any indications on any other close contacts, such as the daughter being vaccinated also?
I don't have that information as yet.
And how important is it for you to piece together exactly where this 81-year-old may have caught the virus, whether it's on our side of the border or New South Wales?
Look, for me, at this point in time, he's infectious, he's got the virus, and now we need to deal with it. So really my focus is on containing this within South Australia. Obviously, it's good to know when we've got the genomics, where it's come from, it's very helpful. But at the moment, our focus in SA Health is getting those double ring fence around this infection.
Professor, are we looking at a similar situation potentially with what we had with the Parafield cluster? Is your level of concern at that level again?
Look, I'm very concerned about this. The other issue here is that it's likely is the Delta variant until we see otherwise, and we know that it's more transmissible. So with the previous variant, and that was when we had the Parafield cluster, we knew that one person on average would pass it on to about 2.5 other people. We also had more restrictions in place then, which meant that it was probably one person would pass it on to more like, 1.5 to 2 people. At the moment with the Delta variant, one person passes it on to 5 other people, and this is what is being played out in Victoria at the moment, a very high hit rate of infection. So we do need to take this very, very seriously. It can run like wildfire.
Can I ask, there was a meeting this morning about truckies and transport over the border. What came of that meeting? Are you aware?
I was too busy dealing with this other issue, I'm sorry, but the Police Commissioner may be able to update you. And I'm very happy to pass over to Grant at this point.
Commissioner, are we able to word please about what level of restrictions you're now looking to impose on the South Australian community?
Before I answer that, just in relation to the meeting with the Department of Transport as well as representatives from the freight industry, I don't have an update from that. That meeting was occurring while Professor Spurrier and I were involved in a situational awareness update, followed by an early directions meeting. So when we get back, we'll get more information. We'll probably have something for you this afternoon in relation to the impact on the trucking industry. We haven't settled on any specific restrictions that are likely to be introduced this afternoon as a result of the current issues we're facing with this particular elderly gentleman, as well as the situation in Mildura and people coming home from holidays in Phillip Island. So there are several factors that are sort of coming together now that compel us to make some changes. The directions meeting we have this afternoon will be where we discuss what those changes should look like. So I wouldn't want to speculate at this time, but as the Premier said, at this stage we don't envisage we're talking about a lockdown.
Without speculating, can we assume that there's going to be a tightening of restrictions on density and public activities and standing up drinking, for example?
Yeah, I think it's safe to assume that we'll be talking about further restrictions being imposed within South Australia on the South Australian community, and I think there's a compelling argument for that to occur. We'll figure out what those restrictions are as we move through the afternoon and through the directions meeting, and then come back and let you know what they are.
Was there any suggestion, which I asked the Professor, of any of these, the family using QR codes, or have there been any issues flagged to you about the non-use of QR codes with this family?
Very early days, Andrew. Well, firstly, SA Police don't have access to QR code data, so I can't answer that directly, but I think there are a lot of energies going into the contact tracing at this point in time, contacting those people who have been QR coded, and obviously we'll do a wider sweep of information to establish any other people who might have been in those premises that we identify, so too early at this stage.
Commissioner, can I just reconfirm, Professor Spurrier said that the staff from Modbury Hospital, they've been sent to, is it to Tom's Court, I assume?
I don't know that, don't have the information.
So a busload of staff apparently left the hospital this morning, so whereabouts unknown.
I just haven't had a chance to get across that level of detail for those things. I'm relying on various aspects of our wide team doing their part to make sure that we respond appropriately. I'm sure we'll have more information later on this afternoon, and we'll have a chance to reflect on all of the activities that have occurred since that 2:30 phone call that Professor Spurrier got.
As we head forward to another weekend where they're illuminating various other events in Adelaide, your early forecast would be, don't get your hopes up at this point that things are going to get any better. The chances are they'll go the other way.
I think I can safely say that we will be imposing more restrictions on the South Australian community this afternoon. The extent of those restrictions are yet to be determined, and we'll be having conversations very shortly after leaving us.
What's your message to people over the next couple of hours if they've just headed off on a holiday or if they're rushing to the supermarket now? What's your advice?
Well, firstly, if people are heading off for a holiday now and they're heading to the Riverland, we would ask them to reconsider the need for that. The strong advice is to limit unnecessary travel into and out of the Riverland because of what's happened in Mildura. Secondly, anyone else considering travel, it's the same as we've said the whole way through this whole event, is be flexible, be prepared to make changes to your travel arrangements, because we simply can't forecast what's around the corner. As much as we try to prevent the spread of COVID-19, that is a significant challenge, and it is highly transmissible, and notwithstanding the best efforts, it may still get through. So people need to be flexible in these times. We are in a global pandemic. It affects everybody in some way.
And Commissioner, what does it also mean for the border bubble? We know that you brought it in from 70 to 40 kilometres
last night,
yesterday,
yep.
and Broken Hill.
So there are no proposed changes to the current border arrangements that were put into effect last night. So for Victoria, we went down to 40 kilometres and we put restrictions in terms of the reasons people can travel from Victoria into South Australia. We've also essentially eliminated the border bubble for New South Wales, which was previously 100 kilometres for the entire border. That accommodated Wentworth and Broken Hill. Given Wentworth's close proximity to Mildura, we have removed Wentworth from that. So the only arrangements that allow cross-border travel now are for Broken Hill and South Australia. And once again, we have tightened up the reasons for people being able to do that.
Last question, please.
Can I just ask an unrelated question? I know your attention's been diverted other areas this morning. But there were two nasty hotel hold-ups overnight, which you may or may not be unaware of, but any reaction to that, or where an investigation may be up to?
Sorry, Mike. This has consumed us all this morning, so I don't have an update on the normal policing business, unfortunately.
Sorry, Ron, do you know if the hospital in New South Wales is a known exposure site at all?
No, don't have that information, Andrew. Thanks.